We'll be starting with the very important topic in cardiac system, that is hypertension. This topic is related to all the cardiovascular disorders. We can tell that hypertension is one of the major cause for most of the cardiovascular diseases. Okay, and this topic is usually asked for 10 marks, and definition, then classification, types are important. Okay, types are very important. Pathophysiology also, it's like I'll be explaining the normal regulation of BP first, then I will just tell about the pathophysiology of hypertension. Okay, then clinical manifestations, complications, then management of this hypertension. Okay, that is also very important. So we'll move on to this topic. I know that you are all aware about the definition of hypertension, isn't it? Now, hypertension is nothing but high blood pressure. Okay, so hyper means increased. So, in hypertension, there is increased blood pressure, and sometimes it is also referred as arterial hypertension. Okay, now this is a chronic medical condition. Okay, once you are diagnosed with hypertension, you know it is not at all curable. You will usually have to take the medications or control your blood pressure, isn't it? And this hypertension or high BP is linked with the many other disorders. Okay, and what is the normal blood pressure? That also you have already studied. The normal blood pressure is 120 by 80 mm, that is millimeter of mercury. Okay, He refers to the mercury there, and 120 refers to the systolic blood pressure, and 80 refers to the diastolic blood pressure. Okay, so that is a normal blood pressure, but sometimes it is told that the normal blood pressure ranges between some particular range. Okay, like we cannot tell that a person who is having a 110 by 80 blood pressure is abnormal. We cannot tell that. Okay, so there is a particular range for the normal blood pressure, that is when the systolic BP can be around 100 to 140. Okay, the systolic BP can be around 100 to 140. Okay, and diastolic can be in between 60 to 90. That time we can tell that it is almost around, that is it's almost normal blood pressure. Okay, but present guidelines is there. Present guidelines is telling that a person who is having a blood pressure more than 130 only, systolic is more than 130, they tell that it is pre-hypertension and all. Okay, so that is a present guidelines, but remember that normally we tell that when the systolic is in between 100 to 130 or 140, and the diastolic is in between 60 to 90. Okay, when it ranges in between that, we call it as normal blood pressure. And you know the measurement of the blood pressure, isn't it? It is given by systolic and diastolic. Why do we get systolic and diastolic blood pressure? Because of the contraction and the relaxation of the heart, that is a myocardium. Because of that we are getting this blood pressure. Okay, now, what is blood pressure? Blood pressure is a pressure that is exerted by the blood as it is flowing through the blood vessels. This definition also you might have studied in foundations last year, isn't it? So, blood pressure is the pressure that is exerted by the blood as it is flowing through the blood vessels. Okay. So what happens is, during hypertension, what will happen during hypertension is, because of the increased flow of the blood. Why there is increased flow is mainly because in hypertension there will be vasoconstriction. Vasoconstriction means narrowing. Okay, the blood vessels will become narrowed. Okay, now imagine that there is a pipe. When the diameter is more, what will happen? The force of water through that pipe will be less. But when the same amount of water is there and when the pipe is narrowed, what will happen? The force will become more. So similarly here also, usually what happens is here, the blood vessels will become narrowed. That is, remember the term vasoconstriction. I will be using it everywhere. Okay, so when the blood vessels are getting narrowed or vasoconstriction is there, what will happen? The pressure of the blood as it flows through that blood vessels, that will be increased. Okay, so what will happen when the force will increase in the blood vessels? The workload of the heart will increase. Okay, the heart will have to pump more and it will have to work more. Okay, so finally what will happen, it will because of the increased workload on the heart, what may happen is slowly the heart may not be able to pump adequately. That will happen after many years. Okay, it will not happen suddenly. It is a very long process. Okay, so finally what will happen is the heart will not be able to pump adequate blood, and that may result in heart failure, and it will result in decreased function of the cardiac muscles. So because of that, it will result in cardiomyopathy. That is also one condition. So many other conditions are there. Okay, so that is why we tell that hypertension is linked with CVD. CVD means cardiovascular disorders. Now the definition of hypertension, as I have told, hypertension is defined as persistent increase in the blood pressure. Okay, not that single reading you got a high reading, that time you cannot diagnose and tell that person is having hypertension. Okay, persistent means continuous. Okay, so when there is continuous increase in your BP, that is your systolic is more than 140 and diastolic is more than 90, then we call it as hypertension. Okay, then hypertension is also referred as silent killer. Now why it is called as silent killer? Because initially when when your BP is increasing, you will not have any signs and symptoms at all. Okay, but slowly it will rise, and after that when you feel that your BP has risen a lot, usually it is linked with the cardiovascular diseases. You will get other cardiac problems. Okay, because of hypertension you can get other cardiac problems. We will see that in the complications as well. Okay, so that is why it is referred as a silent killer. Then hypertension, I told, no, it is linked with many cardiovascular problems. First of all, what happens is most of the time there can be narrowing of the blood vessel. I told it can be because of the fat deposition. Fat deposition is referred as atheroma or plaque formation. Okay, so when the fat is deposited in the blood vessel, what will happen, the normal blood vessel will become narrowed. Okay, so what will happen, when there is narrowing or obstruction to the flow of the blood, it will result in ischemia, that is decreased blood flow to any part of the myocardium. Okay, so that will result in heart attack or MI, myocardial infarction. Next is, because of hypertension, I told what will happen, because of hypertension chronically, maybe after 10, 15 years, 20 years and all, it may result in heart failure. How? That also just now I told, because the workload on the heart will increase. Okay, initially what will happen, the heart will work. Okay, but finally it will fail. Okay, that is heart failure. For example, your rubber band, you are having a rubber band, you are stretching it for some time. Okay, you will stretch it, it will be normal, it will work, but finally what happens, when you stretch it every day, it becomes more and more loose, isn't it? It will have loss of elasticity. Similarly here also, initially the heart will be able to work harder even though the BP is more. Okay, but finally what will happen, it will not be able to pump the blood, so that will cause heart failure. Other than that, not only cardiac problems are there, it may also affect your brain. Okay, why it affects your brain is mainly here what happens is, heart will not be able to pump the blood. Obviously what will happen, all the vital organs like brain, kidney, liver, other organs also, okay, all the organs will receive decreased oxygen. Okay, so because of the decreased oxygen to the brain, here what happens is, it will result in stroke. Okay, stroke is called as CVA. Okay, don't think that CVA means cardio. Okay, CVA refers to cerebrovascular accident, that is related to the brain. Okay, other than that, it may also cause renal problems. Okay, again renal problems can be because of increased protein in the urine, or it could be because of damage to the renal blood vessels. Okay, narrowing of the renal blood vessels or ischemia to the kidney, that will cause renal failure or renal damage. Okay, the World Hypertension Day is celebrated on May 17th. Next is incidence. Now incidence of hypertension is increased in the recent years, and it is noted that people who are having more age group, that is aged population, it could be more than 55 years of age, they tend to have hypertension. Okay, and Normally it is seen that every individual, at least 90% of the individuals who reach 55 years or by 60 years, they tend to have high blood pressure. Okay. And when we compare the gender, males and females, it was seen that males are by the age of 50, males tend to have high BP. Okay. But after menopause, what happens is women also equally get hypertension. Okay. So both the genders are having risk of hypertension, but males little more. Okay. When we compare with the females. Okay. So this is what I was telling. This is a normal heart, and what happens to the hypertensive heart is it will have to work hard. Because of that, there can be increased workload, and even when the workload will be increased, as a compensatory mechanism, the ventricles, okay, the ventricles will start to thicken. That is called as hypertrophy. Okay, so ventricles will become thickened, or hypertrophy will be there. That is also referred as heart failure. Okay, now this point I have already discussed. Estimated 1.13 billion people worldwide are having hypertension. Okay, so it is increasing a lot. Next is moving on to the classification of hypertension. Okay, classification is different, the types are different. Now the classification of hypertension, this is a category wise. This is systolic and this is diastolic. Okay, so normally, you know, the normal blood pressure is 120 by 80. Okay, so this is a present classification of hypertension. So that is why I told, presently if your BP range is less than 140, it is referred as pre-hypertension. Okay, now normal is 120, less than 120, less than 80, that is diastolic. Pre-hypertension means when your BP is in between 120 to 139. Systolic is in between 120 to 139, and diastolic is in between 80 to 89 mm of mercury. We call it as pre-hypertension. Now stage 1 hypertension means your BP should be in between, that is a systolic BP will be in between 140 to 159, and your diastolic will range between 90 to 99. Okay. Stage 2 hypertension means, see the BP range, it is increasing to 160. Okay, so systolic will become 160 to 179, and diastolic will be in between 100 to 109. That is, for example, if your BP is 170 by 100, it will be referred as stage 2 hypertension. Stage 3 hypertension means your systolic will be more than 180, diastolic will be more than 110. For example, if the BP is just 180 by 110, you can tell it as stage 3 hypertension. Next, moving on to types of hypertension. Very important topic. It is asked for 5 marks. Even the examiners during the Viva also, they will usually ask this question for exam. Okay. Now we have got different types of hypertension. It's very easy. First one is primary hypertension. Second one is secondary hypertension. Third, isolated systolic hypertension, resistant or malignant hypertension, white coat hypertension, and pseudo hypertension. Okay, so these many types of hypertension are there. Okay, first of all, we'll move on to primary hypertension. Okay, so now primary hypertension means, you should be knowing that it is because of non-identifiable cause. We are not able to identify what is the exact reason for this hypertension. Okay, that is called as primary hypertension. Okay, so since we are not able to identify the cause of this type, it is referred as idiopathic hypertension. You know what is idiopathy? Unknown cause, isn't it? So primary hypertension is also called as idiopathic hypertension or essential hypertension. Okay, but it is multifactorial. Multifactorial means many reasons are responsible for primary hypertension, but we don't know the exact reason. And primary hypertension is the most common type of hypertension. Around 80% of the people suffer with primary hypertension. Okay, so that was regarding the first type. Now I told it is because of many causes, it is multifactorial. So what may be those causes of increased BP? So primary hypertension can be because of so many reasons. Okay, we don't know the exact cause, but these could be the reason for primary hypertension. First of all, increase in sympathetic nervous system activity. Now before I tell about this point, I want to discuss some things about sympathetic nervous system. Okay, we have got autonomic nervous system, we have got sympathetic nervous system. Now, when we tell about the autonomic nervous system, I am aware that you are all already studied in physiology, isn't it? Autonomic nervous system, it usually regulates the body's unconscious actions. And your sympathetic nervous system, okay, it stimulates your fight and flight response, isn't it? It will stimulate your fight and flight response. And now the sympathetic nervous system is having a lot of effect on your entire body. Now particularly I will discuss only about the heart and kidney here, okay? So in the heart, what the sympathetic nervous system does is it will increase the heart rate. Okay, SNS, everywhere I have mentioned in my slide SNS means sympathetic nervous system will increase increase the heart rate. What will happen when your heart rate is increased? Obviously, when the heart rate is increased, it will increase the cardiac output. It will thereby increase your blood pressure. So that is why always remember, wherever there is increase in sympathetic nervous system, it will obviously increase your blood pressure. Okay, and one more activity is there. When the sympathetic nervous system is stimulated on the kidneys, it will increase your renin. Okay, it will stimulate your renin. That we will see in the regulation of the blood pressure pathophysiology. Okay. So that was regarding increased SNS activity. Okay. So SNS activity will increase your BP. Next is increased salt or sodium in the diet. Okay. When the sodium or salt in the diet is increased, that also tends to increase the BP. When obesity is there or your body weight is more, especially people who are having more fat accumulation in the abdomen region, okay, they tend to have most of the problems, like we call them as apple shaped body figure. Okay, so those people tend to have hypertension, they are risk for cardiovascular problems, diabetes mellitus and all. Okay, next, one more main contributing factor of primary hypertension is DM. Okay, this also you are already aware. Diabetes mellitus will result in hyperglycemia, and these individuals are at risk of primary hypertension. Next is excess alcohol consumption. That also is one of the major risk factor for primary hypertension. Aging, already I have told what happens is as age advances, there is loss of elasticity of the blood vessels, and also aged people can be predisposed to hypertension. Next is smoking. Smoking cigarettes. You know, cigarette is having lot of tar. It is carcinogenic. It has nicotine. Okay, we already know about nicotine. Nicotine is a vasoconstrictor. What is a vasoconstrictor? Already I have told starting. So vasoconstrictor will usually narrow the blood vessel. So obviously what will happen? Continuous smoking, cigarette smoking will result in narrowing of blood vessels, and that will cause vasoconstriction, and it will increase your blood pressure. Then family history. Now suppose if you are having your parents who are suffering with hypertension, there is increased risk that by the age you reach 40 plus or 50 plus, you may tend to have hypertension. Next is physical inactivity, sedentary lifestyle. Nowadays people don't like to go for exercise, they don't like to move around, isn't it? So physical inactivity or sedentary lifestyle is also main cause for primary hypertension. Now actually the causes which I have told here for primary hypertension, same are the etiology for hypertension also. Next type is secondary hypertension. Now secondary hypertension is just the opposite of primary hypertension. It is because of some identifiable cause. Okay, now you should always know that secondary hypertension is because of some other cause, like some other medical condition. When you have some other medical condition, you will get secondary hypertension. For example, if you're suffering with the this kidney problems, if you suffer with kidney problems, endocrine problems, or any neurological problems, okay, that time what happens, if you get hypertension, that is called as secondary hypertension. Okay, because of some other reason you are getting hypertension, that is called secondary. Now the main cause of secondary hypertension, just now I told, it can be because of your renal problems, if you have got any renal disorders, or endocrine disorders, neurological disorders. Okay, or if there is narrowing of your renal artery, okay, that time also, or narrowing of your aorta, or if you're taking certain drugs like OCP, that is oral contraceptive pills, or non-steroidal anti-inflammatory drugs, in that case also you can get secondary hypertension. Next, third type is isolated systolic hypertension. Now, isolated systolic hypertension means the systolic blood pressure is more than 140 mm of Hg, and diastolic, but diastolic will be less than 90. Okay, even though the diastolic is less than 90 mm, remember the systolic is more. Okay, that time it is called as isolated systolic hypertension. Remember, isolated systolic means only this systolic is increasing here, isn't it? And mainly this ISH or isolated systolic hypertension, in this main cause is told to be atherosclerosis. Atherosclerosis means deposition of fat or atheroma. Okay, that is called, that will result in narrowing of the blood vessel, so that may also cause hypertension, and commonly it is seen in old age people. Okay, next one is resistant hypertension, which is also referred as malignant hypertension. Okay, resistant hypertension or malignant hypertension. Now, this is one of the complicated hypertension we can tell, because usually here there is a persistent severe hypertension. The BP will be very, very high. That is, here commonly the diastolic BP, okay, diastolic BP only will remain 110 by 120 mm. Okay, so imagine maybe the systolic here is, for example, around 160 also, the diastolic may become 120. So the BP becomes 160 by 120. Okay, so the diastolic keeps on increasing here. That is called as resistant or malignant hypertension. And most of the time your resistant hypertension or malignant hypertension, it is not at all responding to any treatment. Okay, usually they are not responding to any type of treatment, and even suppose you are not taking the treatment for a longer period of time, usually it may result in resistant hypertension or malignant hypertension. Okay, next one is white coat hypertension. Now this one is quite interesting one. Now, usually in this type of hypertension, the people are normotensive. Normotensive means they are actually having normal BP. Okay. With white coat hypertension, the people have normal BP, but when the blood pressure is checked by any healthcare professional, okay, when the BP is checked by any healthcare professional, their BP will rise. Okay, that is called white coat hypertension. Okay, the reason why the name has come white coat is because healthcare professionals wear white coat, isn't it? So it is referred as white coat hypertension. So remember, these are actually people with normal BP, but when the BP is checked by the healthcare professionals, their BP will rise. Okay, it could be psychological. The reason could be psychological, isn't it? Next type is pseudo hypertension. What do you mean by the word pseudo? Pseudo means false. Okay, so the other name of pseudo hypertension is false hypertension. Now, this pseudo hypertension, it can occur with advanced arteriosclerosis. Arteriosclerosis means, okay, the term athero is different, arterio is different. Okay, arteriosclerosis means here there is hardening or thickening of the blood vessel. Okay, hardening or thickening of the blood vessel. So that time what happens is the blood vessels will become very rigid. Okay, so what will happen is when you are tying the BP cuff on the arm of this patient, and when you are inflating also completely, what happens in these people is, because of the rigidness of the blood vessel, the arteries will not collapse. Okay, and you will get the high reading only. You will get the high reading only. Okay, and this high reading, when you are taking the BP of these patients, you will note down that the brachial artery as well as the radial artery which you are using to check, isn't it, you will usually keep your hand here to see for the pulsation. Even you will keep your steps, isn't it? You will feel that the reading is there. Okay, the pulse will continuously be beating. Okay, it will not even stop. That is referred as pseudo hypertension. Okay, so just remember that pseudo means false hypertension. Here the person is not having blood pressure. Okay, but the reason here is because of the hardened or thickened arteries. That is a condition. That condition is called arteriosclerosis. Because of the hardened or thickened arteries, what will happen? It will not collapse. When you tie the BP cuff and inflate, it will not collapse. So you are getting this reading. You are getting the false reading. Okay, so that is called as pseudo hypertension. Next is moving on to the etiology and causes of hypertension. Okay, so etiology and causes of hypertension are also very, very important. So first of all, we know that etiology is multifactorial. Okay, sometimes it is also idiopathic. We are not knowing the exact reason for hypertension. Okay, multifactorial means many causes are responsible for hypertension. Now, particularly, we will, if I ask you what are the reasons, you can just see the figures and think about it. Okay, so this is the first figure and this is your second figure. Okay, I hope this figure will remain in your mind when this question is being asked. Okay, so the etiology of hypertension is multifactorial, as well as I told you it could be idiopathic. It can be because of two risk factors. One is modifiable risk factor, one more is non-modifiable risk factor. Okay, you can see here modifiable and non-modifiable risk factor. Now the term modifiable risk factor means you can change it. Okay, if you take care, you can also reverse it. Non-modifiable risk factors means you are not able to change the risk factor. Understood? You cannot change the risk factor. For example, age, gender, family history, genetics. You cannot change, isn't it? But modifiable risk factors you can change by having a lifestyle modification and all. Okay. So we will see what are the modifiable and non-modifiable risk factors. So first of all, we will move into the non-modifiable risk factors. I'll discuss all the non-modifiable risk factors. Family history. Isn't it? Family history is one non-modifiable risk factor. I already told if your parents are suffering with BP, it is a chance that you are at risk. Next is genetics. Okay, genetic predisposition. Next non-modifiable risk factor is age. This also I told. As age advances, what happens? Your risk to develop risk to get hypertension also increases. Next one is gender. Gender, I told both males and females equally can get hypertension. Okay. Initially, it is seen that men will get hypertension till 55 years. But after menopause, both men and women tend to get equally. Okay. Next is ethnicity. Okay. Ethnicity, it was seen that hypertension was very high among the African Americans when compared to the whites. Okay, so this is particularly regarding the non-modifiable risk factors which we cannot change. Now moving on to the modifiable risk factors, these are all because of the lifestyle. First of all, stress. Okay, now you know what is stress. Stress doesn't means only tension. Okay, you may think that stress means only tension. Stress can be excess of noise. It can be any infections in the body for long time, pain for a long period of time, if there is inflammation inside your body, or extreme temperatures like heat or very cold, or if you have got any injury or trauma, or response to the life events like anxiety, anger. Okay, or if you have got lot of body weight is increased, or if you have got chronic diseases, all this is stress only. Okay, and you all may be aware what will happen during the stress. There is release of certain hormones like cortisol, adrenaline, or epinephrine. What happens when these hormones are released like cortisol and epinephrine or adrenaline? Usually they will stimulate your sympathetic nervous system. Okay, so always remember, when the stress is increased, stress hormones are increased, it will result in vasoconstriction. Okay, so what will happen? Your BP will increase. Okay, that is the main reason. Please remember, okay, stress will increase or stimulate the sympathetic nervous system, that will increase your BP. Next one is excess alcohol. Okay, excessive consumption of alcohol is linked with hypertension. Next is cigarette smoking. Okay, cigarette smoking not only will result in hypertension but many other cardiovascular problems, because the cigarette smoke has lot of chemicals like tar, nicotine. Okay, many other chemicals are there. It is also carcinogen. Next, diabetes mellitus. People who are having diabetes mellitus tend to have hypertension. Next is elevated serum lipids. Okay, elevated serum lipids means you are having more cholesterol in the blood. That is called as hyperlipidemia. Okay, so that is also, those individuals are at risk of developing what? Atherosclerosis means fat deposition or atheroma or plaque deposition inside the arteries. What will happen when the fat gets deposited inside the arteries, blood vessels? It will narrow the blood flow. Okay, so that is why person who is having increased cholesterol, they will get coronary artery disease or they may get heart attacks. Next is sedentary lifestyle. The people who are not performing regular physical activity or exercises are at risk of developing hypertension and all the cardiac problems. Okay, next is obesity. You know, I have already explained this point. Obesity, especially fat accumulation around your waist, abdomen region, as I have shown there in the figure, those people or those individuals are at risk of hypertension. Usually, those type of figure is referred as an apple-shaped figure. Next is excessive salt consumption. You already may be aware excessive sodium or salt consumption, it is also a it will stimulate vasopressor, isn't it? That is, it will result in increased blood pressure. Next is low dietary intake of magnesium, calcium and potassium. Okay, so when you don't take adequate intake of magnesium, calcium and potassium, your sodium levels will also increase. Okay, so that is linked with hypertension. Next is people who are continuously or using these drugs like cocaine, heroin. Okay, those individuals who are with drug abuse can have hypertension. Next is pregnancy induced hypertension, means only during pregnancy you are getting increased BP. Okay, that you will study in detail in OBG. So such individuals may also later stages of the life, they may get hypertension. Next is excessive caffeine intake. Okay, excess intake of coffee can result in hypertension. Reason is caffeine is a stimulant. It will result in vasoconstriction. Okay, lot of coffee I'm telling. Okay, so vasoconstriction means narrowing of the blood vessels, and that will cause increase in the BP. Next is use of tobacco and its products. You know the different tobacco products like your BD, cigarette is there, hookah is also there, isn't it? Okay, then many other products are there, tobacco products are there. So what happens is the tobacco again is having some nicotine in it. Okay, so what happens when you take nicotine? As I have told, it is a vasoconstrictor. Okay, so vasoconstrictor, obviously what happens? It will increase your blood pressure. Next, this point is the same, excess intake of tea and coffee. Okay, some other factors are also responsible to increase the BP. Already I have told in secondary hypertension, isn't it? Those points also you can include for the etiology. Kidney diseases, if you have got liver problems like cirrhosis of liver, endocrine problems, if you have got any brain that is neurological diseases like head injury is there or tumor is there in the brain, what happens is the pressure inside your brain will increase. Okay, that we call it as intracranial pressure. Okay, so when the pressure in your brain increases, what will happen? It will result in narrowing, vasoconstriction, and that also can cause hypertension. Okay, next is certain drugs. This also already I discussed. Oral contraceptive pills and non-steroidal anti-inflammatory drugs. Okay, so this was particularly regarding the etiology.